Teenage substance abuse: what parents should know. The word drugs strikes fear into the heart of every parent. It's not a new concern, but when it's your child at risk, you need to understand the scope of the problem and treat drug abuse for what it is, one of the most urgent matters any parent could face. How can you tell when your child is using and abusing drugs or alcohol? What is the best way to respond or reach out to him or her in order to intervene? While it is not uncommon for teenagers and young adults to experiment during their younger years, you should never see experimenting with drugs as normal. One important reason to act is prevention, to prevent or intervene in event an addiction pattern exists or is emerging. Doing so could mean the difference between an adolescent history of temporary substance abuse and a lifelong pattern of chronic addictive disease. This is your motivation. Keeping an open line of communication, spending personal time with your child, and bonding as a parent or caregiver, and doing so regularly many years before he or she becomes a teenager, is the most powerful way to prevent your child from experimenting with the abuse of drugs. However, it is not a guarantee of success. All parents have varying degrees of success with this task, but the underlying most important prevention and intervention dynamic is honest communication associated with education, prevention, prohibiting experimentation, and taking action to stop the use of illegal drugs of abuse and alcohol. The reality is that all teens are at risk for substance abuse and experimenting with drugs or alcohol because these substances are readily available.